The numbers are alarming. Worldwide, 1 in 6 of us will have a stroke in our lifetime. And here in the U.S., stroke is the 4th leading cause of death. And did you know that more women than men die of strokes? That's why new guidelines have been issued strictly for women.
Recently, the American Stroke Association convened a panel of experts. They put together a specific guideline for prevention of stroke in women.
What risk factors are different in women than men?
As with heart disease, women are not small men. We have risk factors that are specific to us that need to be called out to give us the best ammunition to prevent strokes.
There's also something about women who have hypertension in pregnancy that they may have a greater risk for heart trouble or stroke issues later.
Obviously, women have hormonal changes. We have pregnancy, we take oral contraceptives, so those are unique to women. There are also risk factors that affect women differently, such as migraine with aura. That's more common in women and it carries a significant stroke risk, especially in young women who may have a migraine with aura and take birth control pills and smoke. That's just a triad for disaster for young women.
Why do more women die of strokes than men?
Actually, every year, 60% of stroke deaths are women. 55,000 women a year die annually from their stroke. The theory behind that is women generally tend to have their strokes when they're older, after menopause. So they have more comorbidities, you're usually alone. Those kinds of things will attribute to the death rate being higher.
But younger people can have strokes too, right? And that's changing.
It absolutely is. About 25% of people who have strokes now are less than 65, so stroke is no longer an old person's disease. Young people can have strokes, hence why young women need to know their full risk factor profile. Everything that can affect a woman and their stroke risk, you need to know that, discuss it with your physician, and find ways to manage those risks.
What will be the impact, do you think, of these new guidelines?
I think it will just give us more ammunition, encourage women to work with their physicians, identify all of their risk factors, not just the ones we're used to hearing about. Again, with a young woman knowing if they have migraine with aura, they need to avoid smoking and oral contraceptives. It just gives us more power to prevent stroke.